As an African American physician, do you guys believe racial biases affect patients of color from receiving quality health care?
What do you think? What do you think?
I think yes. I think it does affect. It affects everything from how the patients are perceived. It affects their relationship with the rest of the whole treatment care team. It even affects policies and also research that's done that helps determine policies. So yes, I do believe it has a big effect.
Because if the doctor is biased towards the patient, then they may perceive the patient in a way that the patient actually isn't. And therefore what happens is the patient does not begin to trust their doctor. They don't actually follow what the doctor wants them to do because they don't trust them. And the relationship just doesn't work from a healthcare perspective.
As a physician of color, what significance do you play in the healthcare system in treating patients of color?
Well, we had been talking about that before also, that in the Bay Area is very multicultural. And so my patient population in particular is very, very multicultural. We have Black people, people of African origin, Asian population, and white people, and all other ethnic groups like Latinos. And so we see a wide variety. So what's my role? My role is to give the best care possible and to recognize that my interactions with each of those individuals is affected by my opinion of those individuals themselves and also where they come from. So I can give good care based on who they actually are. And so I'm always thinking about that, obviously. And as an African American male, I've grown up with a sensitivity to racial interactions. And in a way that's a curse, but in a way that's also a gift, because there is almost an implicit and increased sensitivity to people of color that come through my doors.
Do patients of color seem to be more open to you as opposed to someone else because you're a physician of color?
I say that goes both ways. There are some individuals who, because of their past experiences, they may be more mistrustful of the competency of an African American physician, and also I'm a woman. Sometimes people don't even recognize I am a physician, so, and that works both ways. And other things you have where people want an African American physician because they feel that that individual will probably be able to understand them better and understand their culture, and that they can trust them, because really what you're talking about is a relationship built on trust. That's both the patient and the doctor. So the two of them have to have a level of trust with each other to be able to provide the care they need patient.
And even financial. When you're looking at someone, you know, a doctor may be upset with a patient because they missed many appointments. They missed appointments. So why have you missed so many appointments? And we perhaps may be more culturally sensitive to the fact that maybe they didn't have bus fare, or maybe they didn't have cab fare, or maybe there was some family issue that was going on which prevented them from being there. And that takes a little bit of step beyond just being a doctor. It transports you back to being a person again. And you have to be able to see that person as the person. And often those take on significant cultural meanings, because in other cultures, maybe that's not the case. For a white physician to consider whether a Black physician has enough money to make it there may be a step for them. It may be a step for them. And it may even be a step for me as an African American man who has risen to a certain level of affluence, but simply knowing that that possibly could be a case may be something that I may be more sensitive to, but of course not necessarily.
Dr. Stradwick, I definitely agree with your opinion in regards to the level of comfort between a physician and a patient. As being an African American woman, I definitely feel that another African American physician would be able to attend to my needs differently, just due to cultural differences and other relatable things. From a personal experience, I requested an African American physician, and unfortunately I felt that she had to distance herself from being African American in order to feel prestigious or feel that she was just as qualified as any other white physician.
Yeah, I definitely had a similar experience where I was looking for an African American primary physician, and when I went to go see her, she gave me a diagnosis for something without giving me the proper testing that was required in order to be able to diagnose me with that in the first place. And when I asked her about the diagnosis, she basically told me to go Google it. And so, but I've definitely had situations where I thought I really, really wish that I had an African American physician. For example, I had another time when I went to go see my physician and I told him, something's like wrong, I need you to take a look at it, I really need testing for it. He didn't want to do the testing for it, which is something that had happened before. I'd gone to other physicians and I'd been to the ER and they had all told me there's nothing wrong with you without giving me the testing. And so I told him, you're my physician and I need you to do the testing because I know my body and I know that there's something wrong. And so he did it. He wasn't happy about it. He was obviously very irritated and made it known that he was really irritated that I wanted to go through with having testing done. But upon doing it, he found out that there was something really wrong and I had to have really serious surgery.
I guess for me, I can definitely relate. I also agree to the lack of cultural sensitivity in medicine. And I guess with my experience is that I've had a dentist in the past who told me that if me and my sister keep missing our appointments, that she's going to withdraw care from us. But at the time, it was just difficult to have transportation to these appointments because we didn't have a ride at home. Our main transportation was bus, but she didn't really have, her clinic wasn't located around any bus lines and stuff like that. Her hours didn't really work for me and my sister considering we were in school at the time. And I wish she would have taken all these different considerations and factors of why it's difficult for us to make our appointments.
So I think that it's really important for physicians to, in order to do no harm to the communities that they're serving and in fact improve health outcomes, they need to know the kinds of conditions and the factors that play a role in the actual health outcomes of these diverse populations. Think about health disparities and how it is that certain structures of inequality affect health, like race or class or ethnicity. We can see that there are real differences between health outcomes for people who are members of the upper class or members of the dominant, racial or ethnic group than for minority or subordinated populations. So for example, there's research that's, at least 40 years in the making that consistently shows that members of the upper class have higher life expectancies and overall better health outcomes than members of the working class or lower class. And when we start to think about why this is, it's pretty obvious that firstly, people with more wealth can purchase better health care, better health insurance, starting with that. But then it's also little things like being able to buy organic food or being able to take a walk after work to reduce your stress because you live in a nice environment that's walkable, because you live in a safe environment that's not exposed to high crime rates. And so I think that it's important for physicians to understand these social conditions, to understand structural factors that impact health in the lives of the populations that they serve. Because if they don't, then they might be recommending things for some people like, oh yeah, we want you to take 3 walks a week to lower your stress. And if you're a physician recommending that to an African American male who lives in a neighborhood that is over-policed or even is dangerous in terms of crime, you might be exposing that person to, you might be recommending something that actually might serve to increases stress in that person's life, right? And so taking 3 walks a week may mean being stopped by police 3 times a week and being harassed 3 times a week, or exposing yourself to more of a probability for violence on the street. If you recommend something like, oh, just go and purchase organic food to a person who maybe lives in East Palo Alto, right? Which East Palo Alto just got their first real grocery store. It's not really a reality for some people. So I think